Okay, again, you all are very warmly welcome to our next clinical session. So today we would like to talk about uh, a very important area uh, that you need to practice in your clinical session. That is blood transfusion, right? Blood transfusion. So session mainly focus on the blood transfusion. Anyhow, before going to the transfusion, you need to have some knowledge regarding these blood components and compatibility, right? Those things. So therefore, at the initially, I may explain about those things, and later part of the presentation, we will discuss about the blood transfusion. So anyhow, I don't know whether I can completely finish this session today. If it is not, so we have to go for another day talking about the blood transfusion. Anyhow, let's start our discussion. So, blood transfusion and blood incompatibility, right? Okay. Firstly, I would like to ask about so what is blood transfusion means, right? Okay. So so we have blood, right? We have blood. So I may tell like this way, right? There's one person and there's another person, right? This is person A, this is person B. So if you want to transfer the blood from A to B, if you want to transfer blood A to B, this is we call as blood transfusion. Actually, not only the blood or the blood component, right? In later part, we will talk about what are the blood components. So blood transfusion means you have to transfer blood or the blood component from one person to another person. The person who gives the blood generally we call as donor, right? The person who received the blood at that time we called as what is recipient, right? Donor is there, recipient is there, blood or the blood components transfer from one person to another person. This is generally we call as the blood transfusion, right? So there are certain indications for the blood transfusion, right? So I would like to uh, I would like to take some details from you about the indication for the blood transfusion. So what are the general indication for the blood transfusion? Anyone?
Anemia,
Right. Indication, right? One is anemia. Let's talk about anemia. So what is anemia? Anemia Anemia means the person who is unable to transfer oxygen for a particular place because of low level of red blood cells. It means HP, right? So this is what we generally call as anemia, right? Uh, there are certain classification of the anemia, right? So I will tell about something according to the etiology classification. There are certain names for the anemia. So one thing is iron deficiency anemia. Have you heard about that?
Yes.
Right. So what is iron deficiency anemia? Iron deficiency anemia. What is it? So iron
Insufficient,
deficiency. Yes.
insufficient of iron to produce hemoglobin.
Yeah. It means this is all this is again we can call as nutritional deficiency anemia. So both are same. Nutritional deficiency anemia or the iron deficiency anemia both are same. It means the person has insufficient intake of iron or insufficient absorb of the iron from the meal, right? One thing person can take uh, foods adequately, right? But the problem is what? Is unable to absorb the whole the iron content from the food. Or patient may experience some loss of appetite or some other disease condition. Therefore, he is unable to take the foods, right? As a result of that, so iron deficiency anemia can be presented, right? Iron deficiency anemia. And another anemia called hemolytic anemia. What does hemolytic? Hemolytic. Hemolytic means hemolysis. It means breakdown of the HP, right? Hemoglobin HP. So destruction of blood cells. So there are certain disease condition uh, along with this along with this matter. Hemolytic anemia, for example,
Thalassemia.
DIC, yeah, thalassemia also, right? Thalassemia also hemolytic anemia. It means blood cell breakdown before completing their uh, original circle. It means it takes just around 120 days to destroy. Anyhow, uh, it is destroyed before the uh, particular days, right? Hemolytic anemia, right? Then aplastic anemia. Aplastic anemia. What is called aplastic anemia? Aplastic. Aplastic mean actually all the blood components, not only the hemoglobin but also other blood cells like a platelet, WBC. Generation of all the blood components can be very limited uh, because of some situation, especially due to especially this happen because of the suppression of the bone marrow. You know the place the responsible place to generate the red blood cells is where? Bone marrow. Bone marrow. So when the bone marrow is suppressed, so generation of the blood components can be limited. So therefore aplastic anemia can be occurred. It means all the blood components, generation of all the blood components reduce, decline, right? Then another one is hemorrhagic anemia. Hemorrhagic anemia. What does hemorrhagic anemia mean?
Bleeding එකක් හින්දා වෙන anemia.
Yes, because of the bleeding. So this is actually a bleeding. This is a bleeding, but specifically we can say it as a chronic bleeding, right? Because of the chronic bleeding, right? For instance, let's talk about the patient who has postpartum hemorrhage. Postpartum hemorrhage. So it is classified into this hemorrhagic anemia. And what about the CLCD patient who has a CLCD, right? So generally this patient experience melena. Melena means what? Bleeding into the
Bloodstream
yes
stool.
stool. So it's occur because of the bleeding into the bleeding blood at the lower GI tract, right? So because of the such situation, hemorrhagic anemia can be presented, right? So these are the general overview you can take. You can take about the anemia. So anemia is one is condition, one is indication for the blood transfusion. So what are the other indication for blood transfusion?
Severe blood loss from
Yes,
surgical
severe blood
casualty.
loss. Yes, severe blood loss. Severe blood loss. Right? Severe blood loss. So, for example, for example, yes, severe blood loss. For example, sorry,
Trauma.
traumatic. Yes, traumatic condition. Traumatic condition and surgeries. So, due to the traumatic condition or the surgery, so blood loss can be happen. So, blood loss either internal bleeding or external bleeding. So we can be classified it as a minor blood loss and the major severe blood loss, right? So this is additional thing, minor blood loss or the severe blood loss. So what is minor blood loss mean? Minor blood loss mean, so this is for your general idea. අපි minor blood loss එකක් කියලා වගේ කියන්නේ නිකන් කොච්චරක් විතර වගේ blood loss එකක් වුණොත්. So it is less than, approximately less than 500 milliliters. So if the person present with approximately less than 500 milliliters blood loss, we can classify this person as minor blood loss person, right? In contrast, so severe blood loss means probably more than 750 milliliters, right? More than 750 milliliters is presented, so we can classify it as severe blood loss, right? So in here, so what can we do? Well, I'm talking about external blood loss, right? I'm talking about external blood loss. So what are the action can be taken when the person present with external bleeding, external hemorrhage, right? External hemorrhage. So
Apply
what?
කරන්න ඕනේ.
Right. Firstly, settle down the person. It means it's better to lay down the person. Why? When the patient is lay down position, so his activity is very limited. So limited activities affect their hearts and their heart activities can be reduced. So when the heart activities is reduced, so the pressure of the arteries or the vein can be declined. So therefore, it helps to reduce the level of bleeding. So one is the patient calm down and lay down, right? So that is the first thing that you have to do. And the second, then thereafter, if the bleeding point uh, on the especially extremities, lower extremities or the upper extremities, then you can elevate the relevant extremity above the heart level, above the heart level. So advantage is what? When the extremities are elevated above the heartlet, the pressure on the bleeding point can be reduced, right? The pressure on the bleeding point can be reduced, so it helps to decline the bleeding amount, right? So this is the second thing that you can do. Thereafter, thirdly, so now we check the bleeding is uh, arrested. If it is not, so then you can apply
Direct pressure.
direct pressure. Direct pressure. So what is direct pressure mean?
Applying pressure to the traumatic part or bleeding
Yes,
point.
yes, very good. So the you can apply the pressure directly to the bleeding point. Bleeding point, right? So when you are applying this pressure into the bleeding point, so usually you have to use if you are in the community, you don't have gauze or something else, but you can find some piece of cloth, right? So a small piece of cloth. So uh, this piece of cloth you can apply to directly in the to the bleeding point, and you can apply pressure for at least 10 minutes.
Minutes.
Yeah, at least 10 minutes. So within 10 minutes, if it is not the if it is not a severe cut down, so most of time the bleeding can be arrested, right? So with the mechanism of the body, right? So check after the 10 minutes, you can check whether the bleeding is settled. If it is not, then thereafter you can go for the technique of turnic turnic technique. So this is the final option that you can do in the general setting or the community or the hospital setting. If you are unable to manage using the tourniquet, so then they have to go for the surgical procedures, right? So the tourniquet technique is what? You can apply a tourniquet to the relevant extremities very near to the bleeding point. Very near to the bleeding point. It should be above the bleeding point or below the bleeding point.
About the bleeding.
Above the bleeding points. So in the evidence says that what it's better to apply above the 2 inches area, right? So find the bleed point and above the 2 inches, so you can apply the tourniquet. So anyhow, after applying tourniquet, you have to release the tourniquet
After
within
10 minutes.
10 minutes. Yes, after 10 minutes. So intermittently you have to tourniquet and returniquet and tourniquet and returniquet. So when the patient in the on the community, so when you are transferring, so you have responsibility if you apply the tourniquet to release the tourniquet, right? Right. And the other thing is when you are applying the tourniquet, when you apply the tourniquet, so if it is a low extremity, yes, a low extremities, So turning should be showed to other, right? If it is a trouser, you have to cut the trouser to show the turning. Otherwise, the person might go to the hospital. So anyone does not about the turning because turning's under the dressers. So they are doing other activities. So ultimately, bleeding is okay, but the problem is due to the lack of oxygenation and nutrition to the lower part of the extremity. So lower part might be
necrosis.
yes. So cyanosis and then therefore thereafter necrosis, right? So therefore this is very important. If you apply the tourniquet to the person, you have to give over the relevant information to the particular officers who take over the person, right? Or you have to cut the dresses to show the turning point, right? So this is what you can do in external hemorrhagic occasion, severe bleeding. So we are talking about indication for the blood transfusion actually. So I gave some additional information to that for your further practices, right? Anemic condition, bleeding, severe bleeding. That's mean acute bleeding, right? Acute bleeding. So what are other indication for the blood transfusion? What about the cancer treatment? What about cancer treatment? Cancer treatment means chemotherapy or radiotherapy or both chemo and radiotherapy. So chemotherapy and the radiotherapy mostly affect to the bone marrow. They suppress the bone marrow. So when they suppress the bone marrow, the production of red blood cells can be declined. So the ultimate result is what? Low HB level. This is why a cancer patient often experience low level of HB, right? They are mostly experience low level of HB, especially patients who are taking chemo and radiotherapy. So not only RBC, right, but also WBC also same, right? Cancer treatment, right? Anemic condition, right? And chronic diseases. Some chronic diseases, right? Some chronic diseases. What are they?
CKD.
Yes, CKD, CKD. CKD patients often experience low level of RBC. So where the place the erythropoietin is produced, erythropoietin kidneys. So the erythropoietin is the essential component that person needs to generate the RBC. So the with the chronic such diseases and cancers, so often patient experience low level of HP. So this can be another indication for blood transfusion, right? So generally you can take these areas, consider as these areas indication for the blood transfusion, right? Okay. Then in the blood, right? In the blood, so you take the blood for the person. Now, already I told that blood transfusion means what? Blood or the whole blood or the blood components. Blood or the blood components, right? So therefore, we know that what is blood. So, but there are certain some components is there. We produce these components from the blood, but we are given some different name for these products. So therefore, having an idea about these products also uh, very essential, because you have to practice these things in your clinical setting. So common blood products, right? Common blood products. First thing is, I told that it whole blood. Whole blood is the blood what we what we take from the donor. Who is the donor? We already told about who is the donor. Donor is the person who gives the blood, who donate the blood. Who is a donor? Whole blood means in this blood we are not going to separate. We are not going to separate the blood components. Whole blood means all the blood components are there. So some in some situation we have to give, we have to transfuse the whole blood rather than transfusing component. So this is what we call as whole blood. It's mean in the whole bloods all the blood components, including platelet, right, cryo, right, plasma, red blood cells, all the components are there. So this is what we are called as whole blood. So indication for the whole blood, sometimes patient may experience low level of platelet, WBC, and RBC, many kind of components. So giving separate blood groups rather than giving separate blood components, it's better to give the whole blood. It's better to give the whole blood, right? This is the one advantage that we can taken from the whole blood transfusion, right? And the other thing is, so if you want to separate the components, we need a time, right? We need some time. But when we are transferring this whole blood, we don't want to time, and we don't want to waste much time. So therefore, as soon as possible, we have to give this blood to the person, right? So this is another advantage. But in the whole blood using of the whole blood, some disadvantages are also. So you think about the person who no needs some blood components. If you are uh, if we transfuse whole blood, so in vain some blood products can be entered to the person, but it is not useful for this person. So these uh, components can be used for the another person, right? So such kind disadvantage also along with this whole blood too, right? So this is called whole blood. Then uh, you know it, red blood cells, right? Red blood cells, right? This is the component that commonly we are transfusing in our general setting. Red blood cells. It means we have to separate the red blood cells and transfer them, right? So red blood cells. Then platelet. Platelets also can be separated using centrifuge or other technique. So sometimes we have to transfuse the platelet because if the some person who experience low level of platelet level, uh, in that occasion we have to transfuse platelet. Or if the person present it adequate HB level, but the uh, platelet level can be declined, right? So in case of such situation, we need to transfuse only platelet, right? Therefore, in the blood bank we can see platelet also, right? And another component is fresh
Some
frozen plasma, right? Generally we call as FFP, right? FFP. FFP means this product does not have any cells, right? This product does not have any cells. It means platelet or red blood cells, white blood cells. No. In this product, actually this is the serum, and mostly it is common clotting factors as well as the protein, right? In the FFP, mostly we can see clotting factors as well as other proteins. Especially these proteins and clotting factors, uh, in one way we can expand using this FFP. In one way we can expand the volume, blood volume in the body when transferring, right? And the other thing is the person, if the person experience clotting problem, right? If the patient presents with clotting problem, so we have to transfuse the FFP, right? We have transfused the FFP. So think about patient who has a cirrhosis. In the cirrhosis, so the production of the protein, platelet, WS also same, can be very limited. Can be very limited. So if the cirrhosis patient is going to surgical procedure, so when we are taking a full blood count, we can see their platelet count is very low level. So we know if the patient present with low level platelet level, we are unable to perform a surgery because we know platelet is very important to clotting mechanism to
okay.
activate, yes, right? So therefore we are unable. So if we perform the what you call surgery for this person, there is a risk for bleeding. So therefore we give the FFP such kind of persons in order to reduce that bleeding risk, right? This is why FFP is important, right? So in one way we can improve, expand the volume of the person. Another way we are able to reduce the risk of bleeding, especially for the surgical procedure. That's why before going to the theater, just immediately before transferring, we administer some FFP for a person to perform the surgery. Uh, how much, how many FFP pack uh, has to be given have to be given depends on the patient conditions and the according to the surgery. Anyhow, you have to take it's better to take idea about the FFP is important to what, to reduce the risk of bleeding. This is why FFP very important, right? And the cryoprecipitate. So generally we call as cryo, right? So cryo is actually concentrated clotting factors. We know in the FFP also clotting factors is there, but especially we produce a cryo, it has concentrated clotting factors like factor 8, right? Like factor 8, right? That's why sometimes you may see for the persons who are experienced with hemophilia. Actually, hemophilia persons they have factor 8 drugs production also, but cryoprecipitate also can be given for these kind of persons, right? It means concentrated clotting factor in the cryoprecipitate. And albumin, right? Albumin also can be seen as many uh, drug products. Anyhow, from the blood also we are able to separate albumin and we can administer albumin. So generally these are the main blood components that we can see in our blood bank in our, and we have to use in our clinical setting, especially RBC, platelet and frost FFP, and sometimes cryoprecipitate, right? We have to administer to the transfuse to the patient. So therefore, uh, knowing about these components is important, right? So what about WBC? We are we were not giving the information about WBC. Actually, WBC is not typically transfused, right? We are not typically transfuse 2% WBC, right? But if you want to transfuse WBC also, we need to transfuse whole blood. When we are transfusing whole blood, we are able to administer WBC too, right? But in general settings, we are not separate WBC from the whole blood. Okay, right. Now you know what is blood transfusion and the components, right?